Good day everyone, this is Alors Minor, student nurse from Tomas Cloud Psychologist, and today we will perform an abdominal assessment. But before we proceed, you should perform a hand washing to avoid transmission of microorganisms. For the second one, make sure that the equipment are in good condition. For the third one, identify the patient's name. Sir, I am Alors, your nurse for today. So, can I have your name?
Yes, I'm Ali.
Okay, Sir Ali. So for today, I'm gonna do a abdomen assessment. So is it okay with you, sir?
Yes.
So if you have any concern, so feel free to raise your concern. Is it okay?
Yes.
So the first procedure is inspect the patient abdomen. So I'm gonna ask the patient first if he having stomach issues. So sir, do you having stomach issues?
No.
When was your last bowel movement?
Yesterday.
So how are you urinate? Do you feel any pain?
No.
Okay, so we will proceed to inspecting the patient abdomen from rib margin to pubic bone. So we will note any scars, bumps, or redness that we've seen, including on how was the patient inhale, exhale, and the vascular pattern. So the patient abdomen have a one bumps. The abdomen is symmetrical bilateral. And for the second one, we will auscultate the abdominal quadrants for bowel sounds, or it is the high pitched. Using the diaphragm of the stethoscope, we will place it to the right lower quadrant and listen for at least 1 minute before concluding the absence of bowel sounds. Then repeat it to right upper quadrant. To left upper quadrant. And lastly, to left lower quadrant. So for the result, the bowel sounds is normal. So now we will auscultate the aorta, the renal arteries, and the iliac, and also the femoral arteries. We will note any growths or the vascular sounds that resembling heart murmurs. So ausculting the aorta, we were listening for like a blowing, squeaking sounds. Okay. And you can also auscultate the femoral arteries, which is located there. So now we will percast all the quadrants. Begin to right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. So as you percast, you will note any tympany or dullness, which may indicate a mass or tumor. So for the last one, perform a light palpation and instruct the client to cough. And if he experiences a sharp twinge or pain in a quadrant, then palpate the area. But if not, then still palpate the 4 quadrants. So, you will note the textures and the consistency. So, sir, pwede po ba kayong umubo kahit isa lang? Okay, so, do you feel any pain as you cough?
No.
Then, we will perform a palpation. So, sir, sabihin nyo lang po sa akin kung may nararamdaman kayong masakit. Okay, so sir, may nararamdaman po ba kayong masakit?
Wala.